Dr. Libman, if you could just emphasize the importance of when you call 911 or someone is calling 911 for you, to be very specific about the fact that it might be a stroke.
Excellent point, Ginny, and that is 100% correct. So first, just to emphasize the point, any symptoms of stroke, call 911, either the person experiencing the symptoms, an onlooker, family member, friend, witness, whoever is there, call 911. And when the 911 operator answers the phone, you can say, or as you're looking at the person in your family or whoever it might be, I think my family member is having a stroke. And those can be the first words out of your mouth. The operator may ask you about symptoms, and of course, you can say, well, they're slurring their words and their face is twisted and one arm seems to be weaker than the other side, or they have weakness on one side of their body or numbness on one side of their body, which are the key words they look for. So it's calling 911. The statement, I think my family member is having a stroke, and this is what they're experiencing. And that will expedite the ambulance getting to you, picking you up, getting you to the nearest stroke center. And as we've been referring to over and over again, the sooner you get there, the better, the more effectively you could be treated. So it starts with 911, always.
Okay, thank you again. And I believe the acronym we're now using is BFAST.
That is exactly right. BEFAST. Ambulance EMS workers are using it, doctors, nurses, and we encourage the public to be using it as well. B for balance, sudden loss of balance, or dizziness of any kind. Sudden loss of balance, even head spinning, vertigo, that's the B. E for eyes, actually, for sudden loss of vision. And that sudden loss of vision can be in one eye, or it can be in both eyes, and even including double vision. So basically, any sudden change in vision, that's the E. For eyes, F for face, and that is what most people do recognize when you smile. You could be looking at yourself in the mirror, or somebody's looking at you and seeing it, and one side is going up and the other side isn't. And I'm exaggerating it a little bit. It could be subtle, could be severe, but you see that sudden onset, that's the F, face, and asymmetry in the face. One side droops. A for arms. Are you having trouble raising one arm compared to the other? Is there any arm weakness? Ask the person, raise both arms. One arm goes up, the other doesn't go up as well, or goes up and starts to drift down. That's the A for arms. S for speech. Any speech disturbance. That could mean slurring your words. That could mean word finding. You simply can't come up with the right word, and it's basically something simple, and you can't come up with the right word. Or even understanding other people's speech. Suddenly it's not making sense to you. That's the S. And finally, T for time. Time is brain. Call 911. Any of those symptoms in the BFAST, BEFAST, balance, eyes, face, arms, speech, time. Call 911, get to the emergency department where we can use our bag of tricks and treat you as best we can and hope to make you better, which I think we can often do.
Thank you, Dr. Libman. Be well, and we will see you again sometime very soon.
Always a pleasure.